Today you're going to see a treatment video with one of our 36-year-old patients, Jen, who's actually presenting today with ear symptoms back here. She had 15 years of neck pain from her suboccipitals all the way down to the superior scapula, and she would see chiropractors for maintenance, but they wouldn't help her get permanent pain relief. And thank goodness she had tons of adhesion all throughout her neck and her nerve roots. But today you're going to see us treat the greater and posterior auricular nerves in order to get her relief, and it's going to be 30% better by the time we're done. Enjoy this treatment video.
The ear?
This is still like kind of numb.
Okay. Behind the ear?
So it's behind here, like in here.
Jen came in on this treatment visit and she had some numbness, tingling symptoms going up into her face and behind and above her ear. And it's funny to me because sometimes people are like, oh, these symptoms just pop out of nowhere, and then I'll have to correct them. I actually caused those symptoms that you're having because a lot of these nerves that we're trying to remove the adhesions from underneath there, they go up to the head or the face. And unfortunately, one of the consequences of adhesion release methods type of treatment is that you can sometimes make people sore, irritated, or inflamed. It's okay, it's normal. And by the next visit, she didn't have any issues, so it went away right after this.
At first, it was the whole left side of my face and head.
Right.
Now it's just condensed to
Got it.
the nerve.
Sitting here now, 0 to 10, that nerviness in that spot. Like 10 out of 10?
In the ear.
Yeah.
It really only kind of hurts if
Behind
I
it.
touch it.
What do you feel with this?
I feel like my arms are tired, but the shoulder doesn't hurt. If that's what
Shoulder
you're
doesn't
asking.
hurt?
No.
Look down to the right. What do you feel with that?
A little bit of a
That spot?
pull here behind the ear.
0 to 10?
Like a 4.
11 degrees, 44% function. What do you feel here?
Nothing.
No symptoms with this. CF is 61 degrees, 101% function. What do you feel there?
A slight pull on the left-hand side, but just like a stretch.
Where?
Here.
About 1 finger on each side. What do you feel here?
Nothing.
Nothing?
The greater auricular nerve comes out of the C2 nerve root and it comes on top of the SCM and it goes like this to the back of the ear, and that's the most common nerve that's entrapped for the ear. And it's not great over here. And it's also not great in front of the middle scalene here underneath the SCM. So I'm gonna treat this guy first because this is not great. Specifically behind the ear, you have the posterior auricular nerve and the greater auricular nerve, which come out of the C2 nerve root right underneath the SCM. So one of the things I will often do to check these nerves is see if the SCM up high where it attaches to the mastoid is hypertonic, and that will tell you when that nerve is irritated or stuck. C2, C3, PIT. The PIT stands for posterior intertransverse tissue, and it's not super common, but wherever the adhesions are bad is where we have to treat them. And as an adhesion release methods provider is palpating the neck, they will often just go to wherever they feel the most gluey tension that is blocking the tissue. And that's what I did there and why I treated the posterior transverse.
It still feels like a little, it's the ear. It's like here. This part of my ear.
The back side.
Like the little, like almost like the cartilage. It just feels a little.
No change.
The neck feels great. This just feels, it still kind of feels like a little.
That feels the same.
Numb, yeah.
The ear, okay.
It's a numbness. It's not necessarily a pain.
You'll notice I just got the app out during my treatment visit. Sometimes when I'm not on the right track or I'm not sure what I'm doing, I will immediately get the app out and right in front of the patient. Sometimes I'll show the patient, or I'm talking my thoughts out in my head out loud. I have found that our patients are very interested and happy to be where they're at when the provider is humble enough to say, I'm not sure if I'm on the right track. I don't know if I have this correctly. And therefore I'm looking this up. I believe that patients have a respect for a provider who's willing to be humble enough to say they don't know. Many people in chronic pain are intentionally or subconsciously gaslit by their provider to say, oh, you don't have this problem, you don't have that problem, you don't have a disc problem, so on and so forth. I'm either getting somebody permanent pain relief or I'm not helping them, and therefore I don't know the right answer. Maybe that's a good position for a provider to be in. Like, I'm either fixing you, or if I'm not fixing you, then I'm not the best person for you as a patient. And so if I'm not getting a symptom better in the micro in one treatment visit, I'm obviously not on the right track. So therefore I can be humble enough to say, maybe I can figure this out and I'm gonna get the app out. Generally speaking, when patients or chronic pain sufferers go to providers who say, this is your problem, and it doesn't sound right, or if it's a conservative treatment, it's not fixing them, I tell them to usually run out the door.
It feels better. It still feels like I still just have
Percentage better.
30.
Okay, I'll take
It's still just lingering numbness.
If it, I'm not gonna do any more on that because I don't want to make your ear fall off.
What did you say?
You line your back. When people have nerve symptoms or symptoms from a nerve entrapment, I typically like to make symptoms get at least 50 to 100% better. And depending on how old they are or how degenerated their problem is or how long it's been lasting, that's not always possible. Jen is pretty young. I wanted to get more than 30% relief. Ideally, I'm aiming for 50 to 100%. I would have liked to have made that symptom go away completely, but her nerve was inflamed from the previous treatment. When she came in for the following treatment, that ear symptom completely had gone away. So sometimes there is a time window that we need to respect as providers, 1 or 2 or 3 days for the inflammation in the nerve to die down, because there are blood vessels inside nerves and you can inflame a nerve, and then it just has to spend some time recovering.
So when you did it again, that's what I felt, is it went up to the ear.
C4 nerve root at anterior scalene, moderate to severe, and that was referring to her back of her ear.
20 degrees, 80% function. What do you feel there?
Nothing.
CF is 61 degrees, 101% function. Half finger. What do you feel there?
Nothing.
Okay.